Honourable member.
Madam Speaker, when COVID-19 arrived in this country, we put out a plan to get vaccines out to people. We moved and mobilized quickly. We worked through jurisdictional overlap overnight, literally, Madam Speaker, to save lives. But they're not doing it when it comes to this crisis because of stigma. This minister, is she aware that over 20 years of peer-reviewed research shows that safe consumption sites save lives and increase access to treatment? We heard from the Deputy Commissioner of the RCMP that they want more safe consumption sites, not less. And is the minister aware that the surge of overdose deaths in Lethbridge, Alberta, since the closure of their safe consumption site, has tripled? It has actually tripled that of the death rate of British Columbia per capita. In fact, in Regina, where they don't have a safe consumption site, it's double that of Saskatoon. And also, Madam Speaker, it impacts HIV rates when they don't have harm reduction. Saskatchewan has 19 HIV cases, Madam Speaker, per 100,000. To compare that to the second most, it's in Alberta at 4.2. It's out of control. Will this minister intervene?
The Honourable Minister.
Madam Chair, I am the last person who has to be convinced of why safe consumption sites are so important. Since 2017, with 41 safe consumption sites across this country, we have reversed 55 overdose deaths. We've seen over 4.6 million visits, and we've had over 417,000 referrals to treatment. We know they matter. This is why we work with communities to get them in place. But, Madam Chair, health service delivery is provincial jurisdiction. You know, we can use a hammer and a nail, or we can work collaboratively to move all boats along and have the tide rise. But we have to work with our provincial partners. We're not all on the same page on this. I agree with him. The numbers in Alberta are tragic. But at the same time, Madam Chair, we need to work together as much as we can, because at the bottom line is we want to save lives. This is our goal. These are our priorities. A comprehensive strategy of prevention, harm reduction, treatment, and enforcement.
Honourable member.
Agreeing isn't good enough, Madam Speaker. Safe consumption sites are frozen in Ontario. They're not delivering them in those places in Alberta that I talked about. Now, is the minister aware that in 2008, all 9 judges of the Supreme Court unanimously ruled that the federal Conservative health minister's attempt to close Insight went against the country's Charter of Rights and Freedoms by threatening the safety and lives of the people who need to use it? What has changed for this minister, I want to know, and do we need to do this again? Is this what needs to happen, Madam Speaker, given that the minister is saying that she can't do anything, it's outside her jurisdiction?
The Honourable member.
Madam Chair, quite to the contrary. It's not that we can't do anything. We are a key part of the approval process to enable safe consumption sites to be established in communities, and we continue to do that work. We are fully committed to doing that work. We know harm reduction is healthcare. We know safe consumption sites are healthcare, and we will continue to support the opening of safe consumption sites. With regards to Ontario, I speak to my counterpart, Minister Tobolo, quite regularly about the report on safe consumption sites, but we need to work together, Madam Chair. This is how we'll combat this.
Member.
Minister, think it's appropriate for Alberta to levy a $10,000 per day fine against people providing life-saving first aid by operating informal overdose protection sites?
The Honourable Minister.
Madam Chair, we are working to make it as easy as possible for communities to be able to access supports to be able to set up the sites that they need.
The Honourable Member.
Does the minister see that this is really a province that's implementing a de facto criminalization of medical practices?
The Honourable Minister.
Madam Chair, as I just said, we will work with communities to streamline the process of opening safe consumption sites as much as we can.
The Honourable Member.
Speaker, the federal government should be asserting its jurisdiction and not allowing provinces to threaten draconian penalties to people trying to save lives during a worsening overdose crisis.